As for not-for-profit medical centers, Hawaii Pacific Health relies on donations to serve our patients and their families across the state.
No one knows more about those meaningful contributions than our very own HPH employees.
You are all generous donors.
You see firsthand how funding expands resources and impacts lives.
This year's employee giving campaign really touches home as we hear from a few of our own peers who became our patients.
There are also stories of survival, from a baby born with a heart condition to a man who turned his life around, going from homeless to hopeful.
Hawaii Pacific Health is my family. I'm Kaylee.
I'm Jared.
And our daughter Layla needed heart care at Kapiolani. I think even if we knew, you still can't be prepared for anything like we went through with her.
I met Layla, I think she was 1 or 2 days old, in the NICU. Ebstein's anomaly is a heart defect related to the tricuspid valve, one of the valves in the heart, and the tricuspid valve was not formed well, is what displaced apically in the heart, making one of the chambers super small. So because of that, she was also turning blue. So we needed to help with the saturation, and once the rapid heart rate was under control, we had to think about sending her for heart surgery.
And along with her Epstein anomaly, she has something called Wolff-Parkinson-White syndrome, which has to do with the conduction of the heart.
So about 4 or 5 months of age, she underwent heart surgery at Rady Children's Hospital in San Diego. She has to have constant follow-up visits to make sure her oxygen saturation is normal, her repaired tricuspid valve function is normal, and her rapid heart rate does not come back. And that's what we do in Kapiolani. We check on her heart rate every 6 months.
Having a cardiac cath lab, it would totally change the game for Hawaii. I mean, this is the only children's hospital, Kapiolani, and I think it's so important that we have all the means to treat the kids here. It would have been easier for us to stay here. We made it work, but it would have just been amazing to be here.
This cath lab will help provide excellent care for women, particularly in emergency situations. Something that's routine can often turn really quickly into an emergency where you need excellent technology and state-of-the-art equipment to treat a woman rapidly and quickly.
The most dangerous time for a woman and her baby during pregnancy is actually childbirth. One of the things that we need to do at times is actually remove the uterus after delivery to get it to stop bleeding to prevent the mom from dying. So the interventional radiology cath lab will be instrumental because it's an additional thing that we can do to stop the bleeding and not have to take out the person's uterus.
Both mom and baby can recover in the same facility, side by side, and I think that that is a powerful thing for women in the state of Hawaii.
My name is Ronald Ishikawa. I'm a hospital pharmacist. I've been at Palimomi now for about 16 years. I've been a hospital pharmacist for over 40 years.
And I'm Sybil, I'm Ron's wife. We've been married for 34 years.
On January 22nd in the morning, I started having this pain right here, burning pain. And I thought it was just acid reflux. And usually I drink a cup of water and it goes away. But this time it didn't go away. I started to panic because the pain was getting a little intense. As soon as I got to the ED, they did my vitals, hooked me up to the EKG machine. I saw them wheeling in the code cart, and I said, oh no, something's really bad. I went into VTAC, or ventricular tachycardia, so the blood was not going to my head. Everything went into full speed. Everybody was working on me, took me up to the cath lab.
I was like, oh my God, I just ran out the door to my boss. My husband's having a heart attack. I just ran to my car and I'm thinking, what's gonna happen?
What happens in someone having a heart attack is a blood clot will form, what we call a plaque, and the artery will rupture. But unfortunately in this kind of scenario, that clot that forms is actually harmful and you have a complete blockage of blood flow. And in Ron, his blockage was actually what we call proximal, near the top of the heart. So everything downstream was affected.
saw Dr. Gao show the video, and then I see his artery, you know, he goes, this is the after, when the stent was put in. And then you can see like 3/4 more of the arteries all opened and blood flowing, and it was like, oh my goodness, his heart wasn't getting any blood.
I have to thank Polymomi for the vision of bringing in that kind of service to this side of the island. I knew we had the new cath lab, but I didn't understand how valuable it was. If Polymomi wasn't here, you know, I probably wouldn't be here either.
I'm Mike. I've been a patient at Straub for the past 10 years. If it wasn't for this place, I wouldn't have my leg. Because of them, I'm off the streets now. What brought me to Straub in the beginning was when I first learned I was diabetic. My toes was turning black and I was getting infections from staph, like me when I was on the streets. I come in and I don't have no clothes to leave. And the donations that I get from the Kokua Fund and all the hygiene and everything, it's a big help. For me, it's a big part of what keeps me sober. Well, the reason why I love this place is I've been on the streets for the past 15, 20 years, and the love that this place shows me. They treat me like somebody over here.
I went to his doctor's appointments, talked to his doctor with him, just trying to see how we can get him going on his own, taking more responsibility for himself. He wanted to, but like a lot of our patients, the ones that are high risk are the ones that don't have support, family, just people holding their hand.
A lot of things I'm learning about my diabetes and the things I gotta eat. It's a lot of responsibility, but it makes me feel good about myself because it's something I can do today.
He just had a warm presence about him, and I noticed that he was really struggling. He had a hard time reading, and I asked him, do you have glasses? And he said, yeah, I use reading glasses, but I lost them on the street. People steal things, and I used a Kokua Fund to help purchase him a pair of reading glasses. And he was so appreciative of just a simple act of giving him a pair of reading glasses. His whole face just lit up like he received the greatest gift. And he's just a remarkable example of resiliency and hope. I'm very proud of him.
I would not give anything to go back on the streets. You know, I taught this to a lot of my friends, you know, my worst day today is better than my best day out there. Just by staying around positive people like them, it gives me a good feeling about myself.
My name is Jay Gonzalez. I've been a nurse in the intensive care unit at Wilcox since 2000.
And I'm his wife, Jeanette Gonzalez. I am a nurse in the ER from 2002.
Been married to Jeanette since, how long?
10 years this year.
We met in nursing school. We have twins. 1 boy, 1 girl, 2 years and 5 months, and then we have a newborn.
You massaging Daddy's face just now?
We were working on the garage, and I was feeling kind of fatigued already, and then I decided to go and work out. During the class, I felt chest pain and a little bit of pressure. And I told Jeanette that day that I would drive myself to the ER. Dr. Burris was there, and they worked me up, and I just kept hearing the alarm beeping. And I was wondering, what's beeping? And I look over, and it's my breathing's in the high mid-30s, and my heart rate was fast. Thinking, oh my goodness, this is probably a heart attack.
Our baby was just 2 months old. I mean, we just had a newborn. I'm like, man, you can't tell, we just had a baby.
When I spoke to the ER doctor, it sounded worrisome enough to bring him over to Straub for further care. At the proximal portion of the middle artery, there is a 90% blockage. And his other arteries looked fairly unremarkable, and so we thought that that was the cause of his pain. So we went down with a wire through that artery, and then we put in a stent.
We were able to get him over to Straub and to connect with our cardiologist. They were able to do the procedure needed and then refer him back so he can maintain his care on Kauai. I couldn't be more proud of everything that took place in Jay's case, but I don't view Jay as a unique event. This is something that we do for everybody.
Words is not enough. That's why we are so proud and grateful to work with them. We know that we're gonna do the best we can to help everyone that comes in.
As much as the Employee Giving Campaign is a call to action, it's also a celebration.
Your donations are a direct connection to healing, health, and happiness.
So be a part of this year's Under the Sea adventure as we remind each other that while one gift has a ripple effect,
together, our gifts can make waves of change.